So the first exercise, you're gonna push up from the chair while keeping your surgical leg forward to strengthen your uninvolved leg and your arms for getting up and off a chair safely. Now you're gonna do a mini squat. You'll either hold the back of a chair or a counter and keep your feet shoulder width apart, squat, come up. And you can hold the squat for 5 seconds if you can. 1, 2, 3, 4, 5, and then you'll repeat. 1, 2, 3, 4, 5. Now we're gonna do our heel raises. It's important to get the back of your body strong as well to support your knees and hips. So your feet will be fairly close together and you're gonna go up and down on your toes. Try not to let your feet wing out like this and come directly up onto the bone below your big toe. Perfect. So now lying on your back, you're gonna keep this knee bent to protect your low back, and you're going to push the back of your knee down into the mat for 5 seconds. 1, 2, 3, 4, 5, relax. And again, 1, 2, 3, 4, 5, relax. Okay, now we're gonna do straight leg raises. This engages your core, your hip, and it gets your legs strong enough so you can lift it to get in the car and move around going upstairs and things as you need. So you're gonna keep this knee bent and your low back pushed into the mat so that you keep the core nice and strong. And then take your straight leg and lift it about 12 inches off the mat. 1, and down. 2, and down, and slowly lower down and make sure your low back doesn't come up off the mat. Perfect. So now you're gonna do ankle pumps. Again, super important for getting the blood flow back up from the affected area and to keep everything loose. So up, down. And you can hold it for 3 seconds up, push down for 3 seconds. Good. And this is a great one to do when you're just watching TV and commercials come on, just pump those ankles. Perfect. So now you'll take your affected leg, kick it out, and scoot it as far under the chair as you possibly can. And return out, and as far under you as you can. Because whether it's before or after surgery, you probably have some difficulty bending it. And it's super important to keep your knee bent a little bit past 90 degrees to be able to stand properly, because you need to bring your nose over your toes. And you can't do it if you can't bend your knee. So practice, practice, practice. And after surgery, it might be painful, but you can either have a little bit of pain now and be able to bend your knee or not. Now we're gonna do knee raises. So you'll hang on to something stable, and I want you to lift one knee up towards your chest, no higher than your hip. Perfect. And you're gonna go about 10 times, staying super stable on your good leg. Perfect. You have to do these exercises pretty consistently before and after surgery so you can make some progress. Do them about 3 to 5 times a day and do them about 10 to 15 reps each.